Hey there everyone, welcome back to our channel, World Without Doctors. Today's topic is infertility. Human infertility is defined as the inability to conceive following 12 months of unprotected sexual intercourse without the use of contraception. Infertility can also refer to the inability to carry a pregnancy to full term. This means a lady becomes pregnant yet has repeated miscarriages or stillbirths. About 20 to 35% of infertility cases are traced back to the woman, 20 to 30% to the men, and the remainder are caused by combination difficulties in both partners or unknown causes. 8 to 12% of couples worldwide struggle with infertility. The variables that cause infertility in couples are often present from birth, but they can also develop later in life. Causes in men. Semen is the milky fluid released by a man after ejaculation. This semen is composed of sperm and fluid. The testicle produces sperm, whereas the fluid originates from the prostate gland, seminal vesicle, and other sex glands. Infertility in men occurs when there is a low sperm count. In other words, very little sperm is ejaculated. Sperm counts below 15 million are considered small. Abnormal sperm, for example, has an odd form that makes it harder to migrate and fertilize eggs. Low sperm motility, for example, causes the sperm to swim poorly and hence fail to reach the egg. These problems can be caused by medical conditions like diabetes, cystic fibrosis, mumps, hypospadias, and sexually transmitted diseases like gonorrhea, HIV, and chlamydia. Unhealthy habits like excessive alcohol intake, illicit drug use, and the use of anabolic steroids, which are common among bodybuilders and athletes. Exposure to chemicals like lead and pesticides. Overheated testicles, which can be caused by varicocele, a condition in which a man's testicles are enlarged and overheated. Undescended testicles. Frequent exposure to heat, which can be brought on by wearing tight clothing, working in hot conditions, using hot tubs or saunas. Aging. Overweight or obese. Mental stress, especially if it leads to reduced sexual activity. Cancer treatment, such as chemotherapy and radiation. Structural problems such as injury to the reproductive organs or blockage in the testicles. In women, an egg needs to be released from one of the ovaries in order to become pregnant. Fertilization of the egg is required. The fertilized egg needs to travel through the fallopian tube to enter the uterus and adhere to its inside. The most frequent reason of infertility in women is an ovulation issue, which interferes with the release of eggs from the ovaries. An ovulation disorder can result from polycystic ovary syndrome or PCOS, premature ovarian failure, where the ovaries stop functioning or fail before the age of 40, poor egg quality, thyroid problems, hyperprolactinemia, chronic conditions such as AIDS or cancer, uterus or fallopian tube abnormalities. This can prevent the egg from moving from the ovary down to the womb. This abnormality may be due to surgery, which includes pelvic or cervical surgery. Endometriosis, a condition where endometrial tissue lining the uterus grows outside of the uterus. Submucosal fibroids, where benign tumors occur in the uterine wall. Sexually transmitted infections such as chlamydia can damage the fallopian tube. Medical conditions such as lupus, poorly controlled diabetes, amenorrhea, or the absence of menstruation, genetic abnormalities, age, alcohol use, being overweight or underweight, smoking, exposure to certain chemicals such as lead and pesticides. Symptoms. The major symptom of infertility is the inability to conceive. At times, an infertile woman may have irregular or absent menstrual periods. Diagnosis and treatment. Men's diagnoses may involve semen analysis, in which your semen is extracted for laboratory examination, blood testing to measure testosterone or other male hormone levels, and genetic testing to look for any potential hereditary defects causing infertility. Women may be diagnosed with ovarian reserve testing, which measures the quantity and quality of eggs available for ovulation, imaging tests to check for uterine or fallopian tube illnesses, blood tests to evaluate hormone levels to determine ovulation, hysterosalpingography to check the condition of the uterus and fallopian tubes and look for blockages and other problems. Treatment in men. Improving lifestyle and behaviors, medication, surgery, sperm retrieval. Treatment in women. Ovulation can be controlled or induced using fertility medications, and surgery can be utilized to open the obstructed fallopian tube and facilitate the passage of eggs through. Intrauterine insemination. Healthy sperm are inserted straight into the uterus during ovulation. When a man's sperm count is low, his sperm motility is low. or the reason for his infertility is unknown, this procedure is performed. With assisted reproductive technology, a woman's ovaries are surgically removed. Her eggs are combined with sperm in a lab, and then she either returns the combined eggs to her body or donates them to another woman. In vitro fertilization is the most popular kind, IVF. Additional forms includes intracytoplasmic sperm injection, ICSI, assisted hatching, and gestational carriers. Thank you for watching our video on infertility. If you found this information helpful, please give us a thumbs up and share it with others who might benefit. Don't forget to subscribe to our channel for more informative content on health and wellness. Click the bell icon to stay notified of our latest updates. Your support helps us create more valuable videos for you.